Good morning, everyone. Today we have with us a very young and dynamic family medicine leader, Dr. Vishnu BS. So we will be having a conversation with Dr. Vishnu and know what all he has been doing involved with family medicine leadership. Dr. Vishnu, tell us about yourself. Where are you from? Where you started your journey in medicine, like MBBS, and how did you come to know about family medicine?
I'm Dr. Vishnu. I'm basically from Kerala and I did my MBBS from Government TD Medical College, Alleppey, wherein I completed my internship in 2013, and after which I've been working as a lecturer in the Department of Biochemistry for around 4.5 years. And that is the time when I came to know about family medicine, and in the year 2018, I took up family medicine as a specialty. I did my DNB family medicine from Kim's Hospital, Trivandrum in Kerala. And during my PG tenure, I came to know about AFPI, the Academy of Family Physicians of India.
When you joined MBBS course, what were your dreams and aspirations?
In my UG period, when I joined for MBBS, I was more fascinated towards medicine specialty per se. And in my second year and third year, I used to go to the casualties and work with the medicine colleagues, and I was more fascinated because, to be honest, I didn't know about a specialty of family medicine during that time. But later, when I completed my internship and started working along with others, I came to know that there is a specialty called family medicine where we can give a...
You also mentioned about biochemistry. Did you do a PG, post-graduation?
No, I actually didn't do a PG in biochemistry. I just wanted to prepare for my NEET examination, so I wanted to work and study, so that is why I chose biochemistry as a specialty, but I was more into academics also during that time itself.
So tell us about your postgraduate PG period. How long training was, what kind of institution you were trained at?
I completed my PG in Kim's Hospital, Trivandrum. We were having a very structured training as mentioned by the National Board curriculum. We were having rotations in all the assigned departments, wherein we had 6 months of medicine postings, pediatrics postings, OBG, and also all the clinical specialties like ENT, ophthalmology, psychiatry, endocrine, rheumatology, even physical medicine, rehabilitation, as well as palliative medicine. All this training we had during our training period, which facilitated us to be a better family physician during the training time itself.
So what is your current work like? Where do you work?
I work with Kim's Hospital itself. We manage mainly OP patients as well as inpatients also we are taking care of.
Tell us, I see you as a very dynamic leader. So how did leadership come to you? Did you have an exposure during your school days, college days? How did it come to you? And what do you see yourself? What do you define leader? Why did you take this kind of call that you're doing for family medicine, this service, volunteering for family medicine?
So right from my school days, I've been active in sports and in taking leadership of house activities and all. And that continued even during my MBBS days in my college. And once I took up family medicine, I came to know that there is opportunity for young doctors to be working for the specialty. And that is when towards the late phase of my first year, I happened to be a part of Spice Route activities in my state. And in the next year, I happened to be the PG coordinator of the state Spice Route, or the young doctor movements in the state. So by that, I could interact with so many PGs, know about what the problem they are facing or what can be done to rectify or improve the status of family medicine in the state.
And how do you define a leader? Not about yourself, but now you have exposure and experience. Who would you say is a leader like? Because all domains of every sphere of life requires leaders.
Yeah,
so why do professionals, medical professionals especially, because we are very busy with our studies and then with our work. So, taking out time and taking this call of leadership, how do you identify leaders? Say something about it.
A leader, I would say, is someone who should be knowing what exactly is required for someone who knows about what is the requirement of their fellow beings and what exactly is lacking and how can the lacuna be corrected, and what from their end, or what inputs that can be given from their side, and how we can collaborate with others in the field and get in connection with our peer groups and work together for always. I believe it is going to be a teamwork.
If you look at the family medicine leadership of family physician, there are two aspects. One is like, you address the demands or needs or the challenges of the members of our own faculty, fraternity, or discipline, specialty, especially family medicine where you work. And if you look at the other end, it is also need of the public.
Yes.
I mean, because we are working for the good of the public.
Yes.
So that is also one dimension. Many times there may be challenges because
Yes.
one is trade unionism
Yeah.
of the medical profession, which of course is okay. I mean, every domain, every business, everywhere there is a group of professional leaders who look after the interest of their peer groups. But then there is also community, which is supposed to be, especially in the healthcare, ultimate beneficiary of the health system. So how do you balance between the two? I mean, how do you identify yourself as a leader of your colleagues or leader of the community? How does it go?
So when it comes to the identifying the need of the peer group, so we were when it comes to the training in family medicine, lots of places there was inadequacies which has been faced by most of our residents. So we try to identify what can be done from our perspective. So we brought together all of them and we understood what the real problem is. We tried training them through various programs, through various either physical programs as well as online training programs, through which we could facilitate and make them better family physicians. That was what we first tried from our end for the peer group. And of course for the community needs to know what as a primary care physician they'll benefit from us. So for that we conducted so many awareness sessions, so many camps were conducted where we could give training for them or the healthcare support from them. Also another aspect is even when we come to the hospital based things. So many of the hospitals are having, even the bigger hospitals are having so many peripheral centers. We enlightened them how they can benefit by the service of a family physician. And these peripheral centers will be serving a community. And when we are being placed there as the family physician or the sole doctor of that place, they also realize that we are doing so many things for the community and the community accept us because we are always available for them. They can reach out to us and that in case improve the bondage between the community people and the doctors.
So nowadays we see a lot of mistrust or distrust among the general public about medical professionals. So much of we hear about and read about in media about violence against doctors and healthcare professionals. We heard a murder happened in
Yes.
Kerala also, similar incidences
Yes.
in different parts of India. So how do you see, how would you like to resolve it? How do you like to build this trust bridge which
There
has
is
been lost?
there is two aspects I would say to this. A doctor in a setup is almost always having increased workload. But in this context, to avoid a mistrust or a distrust, as you would say, first and foremost thing is communication. There need to be a proper communication for what the patient is coming to us, what is being planned from our side as a treatment. That should be clearly explained to them. And also the potential harm that can happen with the current presentation or what the problem with the patient has. So mostly what happens is there's no proper communication that is not happening. That is not because the doctor is not well versed for that, just because of the workload, the overburden that is happening is what I feel. Because in that
And
context where most of
also, because if you look at the current scenario where now majority of the healthcare is shifting to hospital setting,
yes,
from the peripheral setting to hospital setting. And hospitals, the specialist care is transactional. Like, you see your surgeon and then you never see him again. You see your cardiologist for a MI and then you never see that same doctor again. Even government hospitals, you go and meet one doctor and next time you see another doctor for the same problem, same department, same OPD.
Yes.
And the family physician is missing in this
Yes.
chain of care. So do you think that the missing chain of family physician is also a reason for lack of trust or lack of communication between the medical profession and the community?
Of course, sir. I would say that if a family physician is there to connect as a connecting link between a specialist and the general community, it is always going to be a boost, because a specialist, as you said, will be busy and he'll not be always available. And the problem is the patient meets one person one time, the next time he goes, that doctor won't be available. But if it is a family physician who connects that particular patient to a specialist, and through a proper feedback mechanism, if that can be communicated to the patient also, that loop is complete, and that would, I believe, enhance the system in the country.
So family physician linkage, which is missing now,
Yes,
if it is restored, the trust within the entire health system will be restored.
definitely that will be resolved.
Let us, talk about spice route. The name sounds very interesting, spice route. So tell us about the spice route.
WONCA, which is the World Organization of Family Medicine, is having a YDM movements in all the continents.
YDM means?
YDM is Young Doctor Movements. That is either a doctor in training or completed training and in the first 5 years of training. That is the definition of young doctors. And across the globe, we have 7 different young doctor movements. And for South Asia, the young doctor movement is called Spice Route.
So tell us about which countries are in Spice Route South Asia. We also have Spice Route India, where you are leading.
Yeah.
So tell us about Spice Route India and how do you organize events, what kind of events and activities you are doing.
So basically, South Asia has 7 countries: India, Pakistan, Sri Lanka, Nepal, Bhutan, Bangladesh, and Maldives. These are the 7 countries that comes in the Spice Route South Asia region. And of course, Spice Route India movement is one of the most active community in the South Asia region itself. We have been active right since 2014. We have been active, and of recently we have more number of residents and young doctors coming up in taking up family medicine and coming up in a big way. So right from I told you in 2019 when I came to be active in family medicine activities, I came to know about Spice Route, and the activities were mostly at that time, almost in 2020 COVID came, it was online. But later, 2 years later, we could conduct so many physical activities. We got to reach out to PGs across India, because there are currently around 500 to 600 PGs at that time in family medicine in the year 2021-22. Now that has come up to around 900 PGs every year. Across this country, we are having PGs. So we try to coordinate the academic activities, and as a part of the state conference, when you're having any state conference, we try to organize an event, especially for the PGs and young doctors, under the Spice Route banner. And every 2 years, when we are having the FMPC, that is the National Conference of Family Medicine and Primary Care, we conduct an exclusive PG update for the young doctors and PG residents.
Do you also help them in their academic activities of examination preparations?
Yeah, 2 things happens whenever a PG is joining for their course. We give an introductory session and orientation on how they should be moving through this 2 years in diploma or the 3 years in DNB course, that we give them at the time of joining the course itself. And every month we try to conduct one kind of academic activities that will facilitate their learning as well as clinical experiences. And by the time they are reaching their theory examination part, we conduct so many sessions to enlighten them on what areas they should be focusing and what should they be preparing, what are the resources they should be properly utilizing for their exam preparation. Even the question banks, all those things will be taken care of. And we also conduct the mock practical exam scenarios, which we label as the PEOS, the practical exam orientation session, which is exclusively conducted by the Spice Route. We are conducting that in different parts of the country, in different states, under the state leadership of Spice Route in coordination with the national leadership. And that is attended by so many exam-bound PGs, which benefits them a lot.
Recently, you have been elected as the chair of the Spice Route South Asia, which is, you are the regional lead. So my best wishes and many congratulations to you.
Thank you, sir.
For this well-deserved position. You have been very active in India. So, I understand that you are digitally, through social media connected to world over, all the young doctors in different parts of Europe, North America, Africa, Middle East, South Asia, of course. Yes. Do you also chance to meet them in person?
Yes.
So tell us about that experience, if you have ever, opportunity to do it.
So in fact, 3 opportunities I had, I would say, in last 2 years to meet the friends across the globe. First was the 2024 Colombo conference, which was a South Asia, the WONCA South Asia Region conference, where that was my first international conference which I attended, wherein I got to be in contact with so many friends from Sri Lanka, other regions of South Asia, and across the globe. And meeting them gives us insights on how things are happening in their countries and how we can improve as a specialty. And that again went one step further when I attended the WONCA Lisbon conference recently. So especially in the European region, where family medicine as a specialty is well accepted and they are practicing it rampantly, it's very important that we need to know how they are actually doing and how they are implementing. Of course, one challenge is population in our country, but still we have so many inputs that can be taken from them. And one other thing is we can arrange exchange programs and all. The being in contact with them facilitate us to have better contact and organize exchange programs so that people from India or South Asia region can go out to other places and get to know what exactly is happening and make them implement in their own places. That is one important advantage which I felt.
So, sounds very interesting that you are able to meet, I mean, in the academic setting, of course, but it must be very interesting to meet, people from different parts of the world.
Yes,
different cultures, different systems.
Of course.
So, tell us something, anything interesting, if you have observation, in Europe or any other part of the country, or any particular experience you would like to.
So you are asking about the
any experience, academic or otherwise, cultural, social.
One thing which I got so fascinated about in attending the Lisbon conference is the advancement of AI that is happening in the current era. We are not, I think we are slightly lagging behind, but the enthusiasm and the passion with which the young doctors in Europe are going behind artificial intelligence and the various things they are practicing or working on it in Europe made me fascinating. And I even following them and trying to bring about innovative ideas which we could implement in our country as well as other region.
Finally, we have to conclude this interview. So I would like to ask a vision for family medicine in South Asia and in India.
First thing is, I would say we have a structured system of family medicine in India, which should be delivering comprehensive healthcare, which we are currently only in the progress of making. That should be made accessible to a wider population. That is the first goal we have to implement, because that is the key for improving the healthcare system in our country. And of course, we have to be connected with the other regions to improvise how they are doing and how we can implement their health systems in our country. Whatever is good can be adopted into the health system.
Thank you, Vishnu. Your enthusiasm is very infectious, and I would say it really inspires to see a person like you to dedicate your time and part of your life into such an important mission, which is not only important for our colleagues, but also for a country like India or our entire population. So my best wishes to you, and I wish you very bright future in family medicine and also in your personal life. Thank you very much.
Thank you so much, sir. You have been one person who have led family medicine in India right from the beginning, and we have always looked upon you as one of the leaders, and so many other leaders along with you whom I would like to take as a role model, like Dr. Reshmi ma'am, Dr. Seren, Dr. Mohan sir, Dr. Jyotika. There are so many people who stood by us and or who led the way. That is what we are right now doing, and we will continue to do and make the legacy proud.
Thank you. Thank you very much.
Thank you, sir.